All right. Good morning, everyone. Thank you for joining us. We can get started. Again, my name is Sophia Sa. I am here from the EOHHS, and we are here having our December stakeholder meeting about the implementation of conflict-free case management in Rhode Island. Next slide, please. Just brief overview of the agenda. Again, my name is Sophie. We will provide you all a status update, information about the participant transition plan, some upcoming materials, and next steps around conflict-free case management. We have our colleagues from Guidehouse joining us, Dustin and Jillian, and then myself, Kiavin Duffy, and John Bonin will be speaking today from the EOHHS. And just a reminder of the rules, the webinar will be recorded and available on our website later on, and we are going to be respectful of everyone's time. And if you have any questions or comments, please utilize the chat function or raise your hand, and we will get to your questions as they come up. So I'm going to get us started now with our status update regarding our implementation timeline. As you can see here, the timeline continues to be, we continue to be on track with our timeline for implementation. We will continue having our stakeholder engagement meetings. I know it says it here ending at the end of this month. However, this is an ongoing process and we want to continue meeting with stakeholders as needed. So we will continue that going forward, including these one-on-one meetings. And then regarding the rules and regulations, that is also an ongoing process that has been started that will continue through 2024. The big things I want to point out is that the conflict-free case management certification standards, the finalized standards, and the application will be available at the end of this month for individuals to begin to apply in January. So once those applications come in, we will begin reviewing them and the certification process of approving those applications. And then we anticipate that in April is when we will have our first certified conflict-free case managers, and that will begin the transition for individuals. And that will be an ongoing transition that John will speak to more at in the next slide.
Good morning, everyone. Sophie, if you want to go to the next slide. What I want to highlight here is just go over the timeline again to highlight some of the big pieces that we've got that are part of the transition. So the first thing that will go into place after, like Sophie said, that we'll be posting the certification standards is DHS will be conducting all the elders and adults with disability initial assessments beginning January 1st. So that will be the first item in terms of our transition to the conflict-free case management model that will occur. We've had discussions with assisted living and the CAP agencies as part of this process, and we wanted to make sure we highlighted that here for everyone. For new applicants, their initial assessments, DHS will begin picking those up in January. As Sophie mentioned, the certification standards that then will be posted, that interested organizations that want to apply to become a certified conflict-free case management agency can review the finalized version and begin filling out the application. That application, we anticipate, getting the initial applications in sometime in February, and we'll go through a review process. Both of those, the reason why the arrow continues on, that is not a one and done process. That is any willing provider at any time can apply to become a certified case management agency as an ongoing authorized provider type here in Rhode Island. We anticipate the billing code for the new conflict-free case management rate will be effective and available to utilize on April 1st. So that's when we anticipate members will begin receiving the services under the conflict-free case management model. And it will be an ongoing transition for the next 7 or 8 months as we go into December, as we will need to know, agencies that are certified and able to operate under this model, and then members will transition to that model. One of the key dates that we have to keep in mind also, though, is the OHA CAP agencies that are currently operating under the OHA certification standards. That certification ends June 30th. So the intent is if those agencies wish to continue, that they would need their applications in early, and that we would be able to transition from the OHA certification standards to the EOHHS conflict-free case management certification standards by July 1st to continue operations under that model. And then the target from CMS is that all members are transitioned to the conflict-free case management model by December of 2024. Go to the next slide, Sophie. I did want to highlight a few things for new applicants. Like I mentioned, DHS will be picking up those new applicants. So as new applications for HCBS, LTSS services will come in, DHS will conduct an outreach to those members that have submitted applications to schedule those appointments for those initial assessments. They will review person-centered options counseling to ensure that the member has received, if they've not already gone through the point and received their options counseling, that DHS reiterates any of their options they need, and the decisions that the member is able to make in terms of the selection of a case management agency and the selection of the services based on their needs. Next slide, please. There will be, for new entrants into the DD system, there won't be any change for new applicants into DD in terms of the way they go through the SIS process with BHDDH. So we did want to highlight that the change for the initial assessment is really focused on the EAD side with DHS, and BHDDH will not be changing their assessment process as part of this. Next slide. When I mentioned that part of this transition will be dependent on agencies that become certified as conflict-free, obviously we won't know that capacity until we begin receiving applications and go through that process of certifying agencies. But we did want to point out that within certain categories of service delivery, members are in some cases receiving case management services from an agency now. If you look at home care and assisted living, the OHA CAP agencies are providing the case management. Those current agencies will need to make a decision of whether to apply to become a certified case management agency. And then depending on that decision, and then members will have a choice of a certified case management agency, as we continue to make sure that we highlight that members do have choice of where they receive services from. But as we go through February, March, and into April, it'll become clearer in terms of the agencies and whether a member can choose to stay with their current agency or whether we will need to transition. But those agencies will need to make that decision. For personal choice, the service advisory agencies, service advisement will cease to exist as a service. It will transition if those agencies decide, but it will transition to case management. And again, members will need to make a decision of, do they stay with that agency or not? Again, that will need to be a member decision. But again, service advisement will cease, but the services that are received by those members will transition over under the certification standards for conflict-free case management. Under shared living, there will need to be a decision by shared living providers, as shared living will continue on as a service, but those members will need to be receiving case management above as they go through, as well as the shared living. As the shared living program standards are out for review, that program is adjusting slightly, but will remain as a service. But again, members will need to choose a case management agency, and the providers of shared living will need to make a decision of whether they continue on as a shared living provider or enroll as a case manager. But as we've highlighted previously, because of a conflict of interest, providers can't be a case management agency and a provider of service at the same time. There are a number of individuals that are still assigned to DHS. Those members will need to choose a case management agency as we build capacity in the system that can be assigned out there, and they're essentially, you know, a large number of members, a lot of them being under the age of 65, that will move from currently assigned to DHS will be assigned or will have the choice to move to a case management agency in the community. And the same thing for HAB and TBI. Currently, those members are managed and supported by the individuals here at EOHHS. We will look to have those members assigned to the community. And then for DD, as we mentioned, it's similar to shared living. For DDOs, again, that's where there's a conflict with members receiving both case management and services. There will need to make a decision on those organizations of whether they enroll as and stay as a provider or enroll as a case management agency. But again, they can't be both a provider and a case manager. We have talked about before that an agency can be a case manager for EAD and a provider for DD. That is allowed, as those populations and services are separate, and the reverse also occurs. You can be a case manager for DD and an assignment of EAD. I think there's a question in here. There's a lot of questions that we'll get to at the end. What we'll do, though, I know there was one that popped in and it came up earlier this week in terms of grace period of transition. So we will allow and we will work with agencies that will need to transition over time, as we know that it'll be difficult for hard stops and starts, that we will work with you on a phased transition to ensure we are 100% compliant by December of 2024. We will work on a grace period to make sure that we have, again, as least of an impact to members that are in those situations where a provider is currently providing services and case management. Again, I know shared living is in that situation, that will work on the easiest way that we can transition individuals with an overlap for both the members and the providers, so we can work through that. I'll pause for a minute. Sophie, are there any questions that are, I don't have the chat open.
There are a few that have come in. I don't know if Jillian, you wanted to go through these, or I can as well.
Yeah, absolutely. So just around this space, John, or do you want me to start from the very beginning? We do have quite a few questions that have come in.
Yeah, we can go down the beginning. So
the very beginning. Okay.
Yeah.
Great.
Annette, I'm sorry you feel that way. Again, I can talk to you separately. We are trying to make it as balanced of a transition as possible with the requirements that we need to meet with the transition, and again, as minimal of impact and allow as much member choice. But again, there's certain things we need to transition to be federally compliant. But again, we'll make as effort again to make sure that the member receives the services that's needed, and we'll continue to receive feedback and work where we can to keep improving the program.
Okay. And we have a question here that says DHS will be doing LTSS in January. What will we do with the people we have on a list that need LTSS?
So they haven't, Barbara, have they not received their initial assessment yet? Is that what you're asking? That they're still going through the initial application process?
And Barbara, if you could unmute yourself to clarify your question there.
Okay, we'll go ahead and move on.
They replied in the chat. Yes, that's correct.
Okay, they will continue on the process that they've been on so far. So if a CAP agency started the process, we're going to have, again, not a hard stop with January 1st, but sort of a grace period. If it already started the process, we're not going to disrupt it to, you know, to make them restart the process. So if it's already started with a CAP agency at this point, they'll continue through to keep that going, and then we'll have an overlap period as we go through January to get everybody transition over to the new DHS process. Again, we know that there's going to be this, what's already in progress and what needs to happen as we go forward. So again, not looking to have a hard stop and start on these things.
Okay, the next one is just a comment here from Annette that says DHS doing assessments is a serious problem that is being ignored. And next question is from Deb. If DHS is doing LTSS in January, but a conflict-free case management agency isn't expected to begin services until April, who is helping our older adults between right now and sometime after April?
So we will continue under the old system until agencies become certified. So again, there's current case management that is available. We'll continue to operate under the old system until agencies become certified. So if a member, at the time becomes eligible in January, February, March, and chooses an agency that has not yet been certified, that's fine. But as we go through the year and we build capacity of certified agencies, they'll need to either stay with that agency if they choose to become certified, or at some point, as we get towards December, we'll have to choose if that agency by that point has selected not to move forward with conflict-free case management. We'll then need to begin reassigning individuals later. But we'll have this overlap of January, February, March of the old as we roll into the new beginning in April.
Next question is from Linda. She says, in the past meetings, we've had concerns about the rate. And has the EOHHS looked into this?
So Linda, the rate for conflict-free case management was set through the General Assembly this last year. So it is not anticipated this time to be relooked. Again, I think we've gone through the methodology a few times of how that was set for the case management services. Other services have been looked at through the OHIC rate review and are going through the governor's budget process now for the other services that are being delivered.
Next question is, will the slides be available online?
Yes, they will be posted after.
Yeah.
Okay, next question. Is this only for new clients who need LTSS? Does this
Correct.
affect
The
ones who
DHS,
already
the
have LTSS?
DHS is for the new applications. Annual reassessments will be by the certified case management agencies as their renewal comes up.
Next question is from Deb. Will the CAP agencies continue to receive funding to case manage seniors until the CFCM agency is identified and becomes certified?
Yeah, the old rate is still active until the new rate and an agency becomes certified or operational. So the old rate will continue until that point.
Okay. Next question is from Marissa.
Yeah, I think I covered the grace period there. And again, happy to talk to Marissa some more offline, but yes, we will work through a transition period as we know that there's going to be an overlap and needs time. So.
Okay. Next question is from Deb. How many individuals are currently assigned to DHS social caseworkers?
I don't know if Rose is on that has the exact number. I know they were somewhere around 24, but I don't want to, if Rose is on or Ramona, if she's got the current staffing number. Okay.
We'll move on.
Yeah, we'll answer that back. We'll get that for you, Deb, and put that in the response. So.
Next question is from Annette. Does anyone else see that having DHS workers do assessments as a conflict? That's not sure. Next one was from Maria. Will we be notified by our BHDDH social worker when to pick an agency if we self-direct?
Yes. Hi, this is Brenda. Yes, there will be, individuals would receive letters and information about when it would be their time to choose a case management agency.
Next question is from Carmela. Will there be a toolkit available to help people understand this transition that we can train our staff on?
Yeah, we've got a number of documents and trainings that are being finalized. So the trainings that will become available over the winter will be available. So there are a number of trainings that are are being finalized and put together that you'll be able to use with your staff.
Is that
Okay.
training only for CFCM applicants, or is that training going to be available to all community-based partners?
It should be available to community partners as well, Deb.
Okay. Sam had some technical difficulties and wanted to go back and had a question. What will the transition look like for beneficiaries of current OHA case management if their case management agency gets certified for CFCM?
Well, the initial intent is they'd be able to stay right where they are, right? And then as we go through the year, it'll come up for the member to make a choice. You know, it's not, they won't have to make the selection immediately as we go through to make it as easy on members as part of the initial transition. That initial caseload that stays there with the member won't have to do anything initially. And then as we go through the year, you know, members will be notified. And again, if they want to make a choice, but they won't have to actively select to stay with that agency. It'll be assumed initially that the members assigned to that agency will just continue to that agency to make it as easy as on everyone. So.
Okay. Next question is from Christine. Is there a role for support brokerage in this transition, and what role will BHDBH social workers have when this process is rolled out?
Hi, this is Brenda. So yes, there is absolutely still an important role for support brokerage. Support brokerage is considered a service. So there's no change to that particular service. With what role will BHDDH social workers have when the process rolls out? So, you know, one of the changes is that our social caseworkers will not be the ones making referrals in the future. That will be the case management organization. We are reorganizing the state social casework team so that there's focus in different areas of need within our division. So more folks will be working on the transitional youth population. We will have some additional folks going into the CIS unit. So we're just sort of reallocating the current staff that we have to do a specific role instead of doing some of the things that they may have done that case managers will do in the future.
Next question, Carmela. She
Yeah.
says, I'm not a case management agency. We partner with our CAP for this. What if they don't follow through with case management?
Yeah, so Carmela, by December, an agency will have to become certified to continue as a case management agency. And I think, you know, we mentioned that the current certification standards for OHA agencies end on June 30th. So we'll actually know earlier than December of whether the OHA agencies will continue on. Again, then they won't be able to continue forward unless they operate under the new certified standards, and individuals will have to be reassigned to a certified agency at that point. So we'll have to go through an individual transition plan, and those services will not be able to be continued under that with that agency.
Okay, and a comment from Sam. I'm curious if you have contingency plans and if you're willing to share them for what happens if there isn't sufficient capacity of certified CFCM agencies
Yeah.
on your expected timeline.
Yeah. So Sam, I think the capacity issue is one of the biggest concerns. As we all know, there's a workforce issue across the entire spectrum of healthcare. So that is a real concern. I think we're trying to examine all contingencies of where we'd be able to assign services. So I think in subsequent calls, we can discuss that further, possibly in the January one, of what we may be able to do capacity wise.
Okay, question from Benita. Moving forward, if a client calls a CAP agency needing LTSS, is it correct that we should direct them to DHS to apply?
Yes, we should begin to transition individuals, you know, to go through the DHS process. You know, at this point of December, with the application beginning and then, you know, January 1st, DHS picking them up, I think that's an appropriate starting point to begin directing folks that's where they'll get their initial assessment from by the time their application gets into DHS and gets processed, and then an appointment gets scheduled for them.
I just wanted to add a point to that. I know the CAP agencies do a lot of application assistance and before the assessment component, and the CAP agencies can continue to do that work. It's the assessment itself that will be directed to DHS.
Thank you, Sophie.
Sophie, I also wanted to add a point too as well. They can also refer to the point as well.
Okay, thank you, Melody.
Thank you, Melody.
And quick question from Crystal. Who do we contact for these one-on-one sessions?
If you can reach out to, I know at the end of this slides, we have the OHHS LTSS email address. If you would like to send an email to that and indicate which sessions you would be interested in, we can make sure that you get invited to them as they come up.
Okay, next question is from Sandra. When it comes time to choose a CFCM organization, how will options be expressed? What information will be provided to the individual making the choice?
As the different case management agencies become certified, as the individual becomes eligible for LTSS, they will be presented the different case management that are case management organizations that are available and the services that they case manage to. Ideally, this will be done at with your social caseworker as you're going through the assessment process.
Okay, next question is from Michaela. After an individual is assigned to a CFCM, will CSM be the place to confirm that assignment in the event the consumer is unaware of their CFCM or needs help returning to that support?
Yeah, so Michaela, currently we are going to be using the current systems we have now. You know, there is a delay in some of the WellSky functionality that we, you know, in the future plan to utilize a universal system, but you'll continue to use the systems you use now.
Okay.
I'll take the next one. I do have to jump off for an emergency management call here on the bridge situation and transition, but Sophie and Kiavin will be here. But the next one from Evelyn, the home care agencies will not be able to apply. You have to be either or. You can't be a case manager and a provider unless you only provide case management to DD. You could do that. Again, it's you have, if you provide home care for EAD enrolled individuals, you can do the provider services. You could be a case management agency for DD in that case. So again, that's how the split is. You can't be a case manager and a provider at the same time. But Sophie and Kiavin will stay on, and again, through email or phone, or I'll be always available to answer questions. So thank you.
Thank you, John. And moving forward here, actually, Robert, it looks like your hand is up, so we'll go to you.
Yeah, follow up to a couple other questions. So the transition period where management agencies, currently you guys are calling them CAP agencies, most of them are CAP agencies. Family's not a CAP agency, but we provide case management for older adults. So the transition period, you know, so to say we will continue to help with the application process for a period of time is, in my view, too vague, because what happens now is we do not get reimbursed for the work that we do for people for whom we are helping until the application is approved. That's a problem already. And so I would look for more clarity about, is it 1 month? Is it 2 months? Because technically people that would come to us and need an application, you know, we need to know if we're supposed to refer those people to DHS. You know, they're not our clients yet, right? Under this new system. So to me, I think we need a little more clarity there about the timeline. So I would appreciate if we could get a little bit more clarity there. Thank you.
Yeah. Regarding the current, so the starting January, DHS will handle all of the assessments. I understand the concern about the reimbursement. That is something that we are still working through the details of that. Since you said that, you know, they're not currently your client until they become eligible for LTSS. Something that Melody had mentioned is you can refer the client to the point for the application assistance component as well. But that is the timeline that we are working with right now. But the specifics of your concern about the pre-eligibility work that you may or may not get compensated for, that you're not currently getting compensated for, we are still working through the details of that and can update when we know more.
Thank you.
Okay, next question in the chat here. Should we be following the same process for people who without or who call for personal choice or SLA? Refer them to DHS first instead of beginning the process at the agency?
Yeah, yes, I would say the personal choice for the SLA. Yeah, whatever agencies are currently doing that pre-assessment, that pre-eligibility work, you can either refer them to the point or refer them to DHS for now.
This is Marissa from Seven Hills, Sophie. So that was my question. So right now the process is people will call from the community. I'm looking for, personal choice program, shared living, what have you. So what typically we do is we sort of start that eligibility process with them. So from this point forward, just to be clear, our intake person can then redirect them either to DHS or the point to start the initial process.
I would say at this point, yes, that is the process we are wanting to encourage right now, but I can clarify that and get you a clearer answer.
Okay, that would be great. Thank you.
Of course.
Okay, and Sophie, I just want to go ahead and transition back to the slides, and we do have one more section, and then we will open it up for Q&A.
Sounds good.
So let's move on to Keegan to provide
All
a
right.
section here.
Good. Thank you, everybody. I got stuck in some of that traffic this morning. Upcoming CFCM materials in December 2023. We will see a CFCM certification standards outline requirements to become a certified case management entity. We'll see a summary of the public comments from posted on October 2nd related to the certification standards. We will see a CFCM application form, and we will see a CFCM draft program manual, which will outline EOHHS's requirements for CFCM and provides instructions and references that case managers need to provide person-centered planning. Next slide. So CFCM application form. Some key highlights from the CFCM application form. This application applies to the entities seeking certification to provide case management to Medicaid home and community-based services. Via the application form, applicants will be provided documentation and demonstrate readiness to provide case management. This is for applicants to be a vendor of conflict-free case management, just to be clear about that, right, Sophie? Just so, yes. 3, requirement application components. Completion of the application form and attestations, proposal narrative, response, documentation policies, on-site visit, and interviews with key applicant staff may be requested as part of the state certification process. And we just want to remind you, is if you have questions during the process of filling out the application, we encourage you to reach out to us, and we'd be happy to answer some of those questions. Next 14. And this is just a reminder of the process for becoming a CFCM entity. The first step is up to 45 days. The second step is up to, which would be the first step, becoming certified, up to 45 days. The second step, obtaining Medicaid ID. New vendors will have to, I just want to say this out loud, new vendors will have to apply to technology, to Gainwell to obtain a Medicaid ID. That's up to 15 days. And then the complete state training is up to 5 days. So it's a total of 3 months. Next slide. Next steps. And so, Sophie, do you want to take next steps? I can do next steps. Activities in 2024, communications. The communication with stakeholders will continue. We have been working significantly on our communication strategy. Website, the Rhode Island conflict-free case management website will continue to be updated with relevant information. As we have been doing in the past, we will continue to update the website. And meetings, small group or group-specific meetings will continue. And finally, the functional assessments starting January.
Amen.
Yep. I think somebody's mic's live. That woke me up though. No coffee in the morning when you have something like that. Okay, functional assessments. Starting January 1st, 2024, the Rhode Island Department of Health and Human Services, DHS, will complete all functional assessments for the EAD population. That means that these assessments will not be done out in the field anymore. Next slide. Okay, questions. If you have any questions, please use one of the following options: chat function, verbally, or email through OHHS, LTSS, no wrong doors, nwd@ohhs.rhodeisland.gov. And we really appreciate all of your questions. It actually very much helps us in shepherding this program forward. So thank you everybody for participating in that part.
Okay, and we will go back to the chat, and also feel free to raise your hand if you would like to ask your question verbally, and then we can kind of switch back and forth. So I do want to go back. Carla had just had a comment here that said the point does PCOC so they can come to us. Deb asked a question: what is the funding mechanism for CAP agencies to continue helping people with the LTSS application? And then we have
I think that was answered before.
Thank you, Deb. Thank you, Deb.
The question from Noah: LTSS SDWs can't express preference for CFCM agencies, correct? How will they help the applicant make the decision while remaining neutral?
That's a great question. Sophie will take that question.
Yeah, correct. Yeah, it would be similar to how you provide information about all the available providers. It would be a list of the current certified conflict-free case management agencies and just explain the services that they provide and the ones that are available, and allow the client to make a decision based on what aligns best with their specific needs.
Yeah, just to add on to what Sophie was saying, so the plan was to also have a fact sheet for each of the different agencies that would be provided to the participant. So within the fact sheet, they would have who the case management agency is, their location, and then the type of, or the population that they're supporting, as well as any languages that they're able to support. Looks like we have a hand raised. So John, you want to unmute yourself?
John, you're still muted. Could we unmute Mr. Souza? Could we unmute him? Are we?
I think.
I don't have the option to.
Sorry, I don't believe I can unmute someone. Apologize.
Well, John, while you figure that out, we'll move on to the chat.
Oh, wait, can I just quickly follow up on my question?
Sure.
This is Noah.
Yeah.
So if the client, I used to be a social case worker, and a lot of the time you give them options and they just say, choose the best one for me, pick the best one for me. So what will there be, will it just be like, okay, based on what location they're in, like how much latitude will the social case worker be given in this situation, or is there like a rotation? You have to just kind of or throw darts at a dartboard. Like what's the procedure there?
And ideally we would encourage that it does, the choice is up to the participant, and we do not want to take away the participant choice. The specifics of how we would outline the case management agency. The available ones after, if the participant does not make that choice, is still being outlined, but we do want to reiterate that the focus is for the client to have the choice of where they would receive the services from.
Right,
Yeah.
right. But I mean, just saying a lot of the time there's, there's a lot of decisions the clients have to make, and making a decision between a bunch of agencies they haven't heard of isn't necessarily the one that they have the headspace to do.
Yeah,
Right.
the state's program manual that it anticipates posting at the end of this month, it will list out what the auto assignment criteria would be in that scenario, Noah. So if the participant doesn't have or doesn't want to make a decision, or they want the case manager to do that for them, they would do the state's auto assignment criteria, which would consider the agencies that are available, their capacity, and then also proximity to the participant's proximity to the case management entity. All that will be clearly defined in the program manual.
Okay, great. Thank you.
Okay, John, it looks like you were able to unmute, so we'll go back to you.
Yeah, thanks. This is really interesting, and I really appreciate the fact that there's about 130 or 40 people on here, and there are lots and lots of questions. I'm sitting here as a parent and also as somebody with a disability, and thinking, well, there's about 11,000 or 12,000 people who are going to be personally impacted by this program. And so the first thing that comes to mind is, how can you possibly, at this point in time, explain to 11,000 people this pretty important and dramatic change without just creating mass confusion? I'm concerned that your timeline is so ambitious that we're just going to kind of create a panic of confusion for the next year or so. And I know that you're willing to meet with individuals or small groups, but my big concern is, and my big question is, how are you going to transmit this information to large groups, the 4,000 parents and individuals or more who are in the DD system have a pretty good network of communication, but even in that group, there's tremendous amount of concern and anxiety. I doubt that the other groups that you're going to be covering are as well networked as the IDD group. Long little sermon here. Sorry about that. But I guess my question is, how are you going to get information out? Are you going to increase DHS's and the state's ability to answer the phone? Every time I have to call somebody on the phone, I have to sit around for hours, often getting people who then tell me, duh, I don't really know. Let me get back to you. That kind of response to 11,000 people is going to cause chaos. So how are you going to communicate this stuff to us who are not as sophisticated as you?
So, Sophie, I know that you've got this. So you've got this.
Yeah.
So this is
ahead,
Brenda. So can I just start a little bit? Hi, John. And
Hi.
everyone. I just wanted to say that on the DD side, anyway, one of the things that we plan to do is, we've been talking with folks in a variety of ways in the newsletter about conflict-free case management so that they are as up to date as possible. When the time comes when people are individually sort of ready to go to work, to do their next plan, and that's the time that individually they will receive that information through a letter, through their current social caseworker, so that a choice can be made and a warm transfer can be made between, what they're currently doing to the new way and the new person who will be supporting them to develop their plan.
So Brenda, if you're going to do that, can I make a suggestion?
Absolutely.
Take a look at the kind of communication your department and the state currently sends out to individuals, and you will see that it is written at a literacy level that is way above anybody's expectation. You have to be a lawyer these days to understand what we're getting from Medicaid, from DHS, and all of that stuff. So first thing is, you better think about changing the level of communication style and language that will make it understandable. Secondly, you have to recognize that much of the communication that goes to my son Mark, as a specific example, goes to his apartment, and he does not live with us. He lives in his own place. And so whether we as his parents ever find out about what communication he's receiving is much related to the luck of the draw. So if you're going to be doing that, I think you ought to be double communicating both to the individual and to somebody who cares about that person, either family and others, not just thinking about, the people who have guardians. Not everybody has a guardian. Not everybody should have a guardian just to be able to get a letter telling them what's going to happen to this individual. So I think you need to rethink how you communicate with families. So those are two really simple but very complicated suggestions that I think other parents will probably say, yeah, I've had the same kind of problem.
Sure.
Thank
So
you,
just to respond to John's comment. So I hear you, John. So we have a relatively new kind of communications team who's been working very hard at sort of plain language documents to help share information with participants and their families. So they will assist us with doing that. We also, we collect more than just the individual's address. So we collect, family members' addresses. If they're working with a provider, we know who those folks are as well. So when we are doing this individualized communication around, it's your time to develop your plan and you need to connect with a case manager, we will develop ways to make sure it's not only the participant, but if there are others involved in their life typically that support them and they've given us their address, we will work towards communicating with really their team, their support network.
Thanks, Brenda. Thanks, John, for your comment. Since we do only have 10 minutes, we're gonna switch to the chat.
Perfect. Okay, so next question here is from Robin asking, will assessments be done in the home by DHS?
The intention, yes, is to have the assessment be completed in person by DHS social caseworkers.
Okay, next question also from Robin. Will LTSS apps be complete by DHS in person in the home, or will they still be mailing them out and leaving it on the client?
I don't believe anyone from DHS is here to speak to that specifically, but I would anticipate that DHS, our state staff can also do application assistance, so they would support that as well and make sure that the application gets to the appropriate place.
Thank you. And Linda asked, when will training documents be shared?
We are hoping that training documents from the state side will be shared by the end of this month, at the latest the end of next month, depending on how we work out some of the things with the interagency build.
Okay, thank you. Next question is from Lygia. What is the expectation of number of agencies joining as a CFCM certified and the caseload capacity to ensure the 90-day turnaround time for processing?
So as far as the expectation, to kind of go back to what John was saying earlier, there are a number of agencies that do case management currently, and we would hope that they become certified conflict-free case managers since they are already doing case management functions, and that they would be able to staff up according to the standards that are outlined and be able to ensure that they have the necessary resources to follow the standards outlined in the CERT standards.
Thank you, Sophie. Next question is from Michaela. Can you clarify the assessments won't be occurring, in quotes, in the field any longer and will need to be completed in a DHS office?
Yeah, I think John meant by a community organization, like such as one of the CAP agencies or one of the other agencies. It can still be done, it will still be done in person, but by a DHS worker, not a community organization.
Yes, that's correct.
Thank you. Next question is from Jennifer. Are the CAP agencies going to have a say in what the outline is provided on the agencies that are approved?
Are the CAP agencies going to have a say?
So yes, if you become a certified case management agency, we're going to ask all of those new certified case management agencies to put together a sort of brief one pager to describe, a little bit about their particular organization so that folks can make an informed decision.
Okay, thank you. The next one is a comment from Mary Lou. She states, for older adults, they usually opt to receive services from an agency that is closest in distance to them. Thank you, Mary. And we can go over to the hand raise go ahead, and Deb, if you want to come off mute.
Hi, I appreciate you guys holding these Zoom meetings. I would like to ask that you hold some community-based meetings for those of us who are serving the older adult population. Last week was great, and I'm really glad that Linda over at St. Martin de Porres was able to hold this. If I'm understanding correctly, and I've been in a lot of these CFCM meetings, the PCOC meetings, the EOHHS mini grant renewal, Medicaid renewal meetings, and I'm trying to understand what the perceived workflow is. I am not a CAP agency. We are a CBO, as many people here know. Mm-hmm. And so there are a lot of us on here who really want this to be successful because we are the face that our older adults are looking at as they're struggling to get these things done. And we want sincerely to help them. So I will say Mrs. Smith lives in Warren, Rhode Island, and she needs help bathing and dressing, and her income is $900. She has very little assets. She needs LTSS services, home and community-based services. So when Mrs. Smith calls me, if I'm understanding what you're saying correctly, is that my role is to direct her to the point to receive PCOC counseling. The point, I've heard two different things. They can do the application over the phone with her, or that they can mail it out to her. Either way, Mrs. Smith gets that 42-page application, is somehow able to read it, understand it, fill it out, make the copies necessary, has an 8.5 by 11 envelope and the stamps and the ability to get to her mailbox to send it back in. It then goes to DHS. You send out a DHS social worker to do the assessment to see if she's eligible, medically needy, etc. Then it gets referred to a conflict-free case management agency, which will not be identified until April. At that time, the conflict-free case management agency identified in April will then meet her in her home in Warren and offer her different opportunities. And we will assume, granted it's a big assumption, that she's choosing a home care agency. Then in April, the CFCM agency is going to try to secure a home care agency to get her help. But between now and May, there's not a lot of opportunity for her. First question, am I understanding the current anticipated workflow correctly? Second, can you provide a training to the CBOs so that we can all work in the same direction to get that application done correctly the first time, because she's going to turn to her senior centers and her community-based organizations. Help us help them, please. So I just went through a lot.
Yeah. Thank you. I do those two questions there at the end turned it over to Sophie.
Sorry, can you repeat the last acronym that you used, the CVO, or SVO? Which acronym were you referring to?
The CFCM Case Management Agency,
No, sorry.
PCOC?
I think at the last end of your sentence, you said like CVO, and I'm just not
Oh,
familiar.
the CBO, community-based organizations, not just the CAP agencies, but all of our community-based organizations.
Okay, great. Sorry, I'm not familiar with that acronym. There's a lot of acronyms in this world and just wanted to clarify what you.
Yeah, no problem.
I would say that the outline you indicated follows the general flow of what we are anticipating the case management flow to look like. Just wanted to reiterate the concept of there no wrong door in approaching the LTSS system. So wherever you go, you will get the important information that you need. We don't want there to be like you go to your community organization and there's, you know, no ability to help. We want to make sure that the right information is still getting to the clients. I would say that once you are a certified conflict-free case manager, that referral process we anticipate to start, that you outlined, would start in April. As John had said, there's going to be a little bit of a transition, and what happens now would continue happening, minus the functional needs assessment being handled by DHS. And as far as making sure we get the appropriate documentation, you know, to help the individuals to fill out the application, I do think that that is something we can work on in terms of developing, like, these are, you know, this is what a completed application looks like. These are the things that will be needed. And that is information that we can share and ensure that, you know, you guys are the face of that people are going to first. And we do want to make sure that our clients and participants are getting the right information. I think that is a great way to make sure that this flow happens seamlessly going forward.
Thank
I
you.
answered all your questions.
And Deb, one thing I would add, so this program manual that will be released at the end of this month, it's going to go into a lot of detail on those specific types of questions that we're getting about the details and how things are done. If a process, it hasn't been developed or the state's still working on it, in the manual it'll say pending process, but a lot of your questions will be addressed in the manual. So the actual steps on how someone will start to receive conflict-free case management.
Okay, thank you. We do have 2 minutes here, so quickly. Annette has a comment and Kai kind of has a follow-up. So Annette says, sometimes communications don't even get sent. For example, no one was notified in advance of being automatically enrolled in neighborhood integrity. It took work, multiple phone calls and letters to opt out. And so Kai jumps on there and said, you know, can we please have a parking lot considered for these meetings? Especially for the last one, there's a lot of questions being raised that remain unresolved. I appreciate that EOHHS has offered to follow up offline, but do feel it is appropriate for understanding questions to be kept on the radar in some way as these discussions may continue.
Yeah, so I'd like to take that. Kai, I really appreciate that comment. Typically what we try to do is get those questions back within 30 days from the last meeting. Because of the holiday, we held this last December 14th meeting only about 2 weeks from the the November 30th meeting. And there just wasn't enough time with the other work that we are doing to completely finish the questions that had been asked in the end of November. Our plan is to absolutely answer the outstanding questions and have these the November questions done by the end of this month, as we had stated in what will be coming, and these questions to either be done by the end of this month or mid January.
Thank you. And we are at time, so wanted to respect people's time here. Thank you for joining us. If you have any questions, please send them into the email box there. Have a wonderful rest of your day.
Thank you, everyone. Have a happy holidays.
Thank you.
Have happy holidays. Bye-bye.